Okay, let's just plunge right into it. Because the raw truth of human life is, well, our shared vulnerability
Yeah.
to sickness, to suffering, and ultimately, death. It's this constant thing.
Mm.
And for centuries, probably forever, we've held on to this idea, this hope of somehow beating it.
Right. Conquering disease.
Exactly. Wiping out the very things that kill us. Welcome to the deep dive.
Mm.
Today, we're grappling with that massive ambition. We're tearing into a load of material that lays bare the global reality of what actually kills us, the incredible progress we've made fighting back, and the big question, can we ever really eradicate disease?
Yeah. We've pulled insights from, key global health reports, lots of research data and analysis from organizations tracking this stuff worldwide,
Yeah.
looking at everything from specific bugs to chronic conditions, even the cutting-edge tech that's changing how we think about health.
It sounds like a pretty comprehensive, maybe sobering look at this battle.
It is. It's a relentless fight, really, on a huge scale.
And our mission for you today is to kind of distill all this dense info, give you a really clear picture of what's shaping global mortality, what's actually working against it, and, well, how realistic is that dream, eradicating disease?
Yeah.
It's heavy, no doubt, but stick with us. There are some astonishing facts in here, and believe it or not, real glimmers of hope. Let's unpack it.
Okay, so when you look at the global ledger of death, the sheer numbers, certain enemies really dominate. Ischemic heart disease, basically, stuff leading to heart attacks, it's consistently the top global killer.
Still number one.
Still number one. And it's not static either. It's actually climbed quite a bit over the last couple of decades, accounts for a huge chunk of all deaths worldwide.
Right. So that's the grim leader. What else is high on this charming list?
Well, cancer, in all its forms, is usually number 2. Then you've got stroke, chronic lung diseases like COPD, that's chronic obstructive pulmonary disease, basically makes breathing hard.
Yeah, nasty stuff.
And lower respiratory infections like pneumonia.
And we saw a huge shocker recently, didn't we? COVID-19 didn't just, climb the list. It exploded onto it.
Oh, absolutely. It became one of the top causes globally super fast. Millions of deaths. It just shoved everything else down.
A brutal reminder.
Totally. And what's really striking here is how much non-communicable diseases, NCDs, dominate now.
The chronic stuff, right. Not infections.
Exactly. The vast majority of the top 10 global killers are NCDs. It shows this big shift, the epidemiological transition people talk about. As countries develop, they move from dying mostly of infections to dying mostly of chronic diseases.
But it's not the same picture everywhere, is it? It changes massively depending on, money, income levels.
Oh, yeah. That's where you see these massive health inequities just laid bare.
So low-income countries.
Still a devastating reality of communicable diseases. 8 of their top 10 killers in recent years were infectious. Malaria, TB, HIV/AIDS. Though actually, HIV/AIDS deaths are way down, like 60-something% since 2000, which is huge progress.
It is huge. But still, malaria, TB, diarrheal diseases.
Yeah, diarrheal diseases hitting young kids hard, neonatal conditions, still rampant.
Okay, so that's the poorest regions.
Yeah.
What about middle-income countries?
They often get hit with this double burden, still fighting infectious diseases, but also seeing NCDs rising fast. Heart disease deaths, for example, really shooting up there.
And high-income countries,
Yeah.
where we see maybe the end point of that transition.
Yeah, NCDs are totally dominant. Heart disease, stroke still big, but look at Alzheimer's and other dementias, they've surged. Almost 4 times higher since 2000. Becoming a leading cause, potentially overtaking strokes soon.
Wow. 4 times.
Yeah. And interestingly, these are the only countries where deaths from heart disease, stroke, and some cancers like stomach cancer actually decreased in absolute numbers over that period.
So the global pattern is kind of like develop economically, swap dying from infections for dying from chronic stuff, often linked to lifestyle, aging.
Right.
But you also get better at managing some of those chronic problems and the old infectious ones too if you have the resources.
Exactly. It's complex. Health isn't just biology. It's tangled up with development, infrastructure, social factors. Where you live really shapes how you die.
Okay, that landscape is, well, it's pretty stark. But like you said, we fight back relentlessly. So what does that fight look like today? What progress are we making against these big killers?
Well, once you know the enemy, you figure out how to stop it, or at least treat it. And honestly, the progress has been incredible, even if access to that progress is wildly uneven.
Let's hit the big ones. Heart disease and stroke. What's the game plan?
Prevention-wise, it's a lot about lifestyle, Eating better, moving more, managing stress, and absolutely ditching tobacco that's huge, damages blood vessels like nobody's business.
Right, and controlling blood pressure, cholesterol.
Yep. Blood sugar, too. Limiting alcohol helps. For treatment, we've got an arsenal. Statins, blood pressure meds, aspirin. Then there are procedures like angioplasty, putting in stents, or bypass surgery for severe blockages.
Stroke. Speed is key there, right?
Totally. Recognizing signs fast, like the BE FAST acronym people mention, and getting help immediately. Clot-busting drugs, sometimes surgery, then lots of rehab.
Okay, cancer. Terrifying word. What's the science say about beating it?
Well, a huge chunk, maybe 30–50%, are preventable. Again, number one thing, avoid tobacco. Limiting booze, healthy weight, diet, activity, vaccines like HPV for cervical cancer, Hep B for liver.
Reducing exposure to nasty stuff too, sun, environment.
Exactly. And screening is vital for catching things early: colorectal, breast, cervical cancers. Treatments moved mountains. Surgery, chemo, radiation are still staples, but we've got targeted therapies now, hitting specific cancer cell weak spots and immunotherapies.
Using your own body to fight it.
Yeah, unleashing your immune system. It's incredible stuff. Plus, global initiatives are pushing hard on specific cancers like cervical and breast, especially in poorer countries.
What about the stuff that chokes us? COPD, lung infections.
COPD, again, largely smoking. But indoor air pollution from burning wood or dung, massive problem in many places. So quit smoking, clean up the air. Vaccines help prevent flare-ups. It's not curable, but you manage it with inhalers, oxygen, rehab.
And infections like pneumonia.
Basic hygiene is huge. Hand washing, avoiding sick people, vaccines against flu, pneumococcus, MMR. Treatment depends if it's viral or bacterial. Rest, fluids, or antibiotics. Severe cases need the hospital.
Okay, infectious diseases. We lived through COVID. What about the classics? HIV, TB, diarrhea?
Right. COVID. Vaccines, masks, hygiene, antivirals. HIV/AIDS. Prevention like pre-P meds, circumcision, condoms, but the real revolution. Antiretroviral therapy, ART.
The treatment that changed everything.
Completely. Lifelong treatment suppresses the virus. People live long, healthy lives, and they can't transmit it. Those 90-90-90 targets, they drove huge progress.
Kidney. Still a tough one.
Yeah, treatment's a bitch. Months of multiple drugs. You have to stick to it perfectly. Otherwise, boom, drug resistance. MDR-TB is a nightmare. Prevention involves treating latent infection and infection control.
And diarrheal diseases. Still killing kids.
Tragically, yes, but so preventable. Safe water, sanitation, hand washing, breastfeeding, rotavirus vaccine. Treatment's mainly about stopping dehydration with ORS, oral rehydration salts, and zinc. Simple, cheap lifesavers.
What about the brain stuff? Alzheimer's rising and the diabetes explosion.
Alzheimer's. No guaranteed prevention, but managing heart risks, blood pressure, diabetes, cholesterol seems to help. Healthy life, staying social, keeping the brain busy. Treatment used to be just symptoms, but now, a new era. Drugs targeting the underlying amyloid plaques, trying to slow it down.
And earlier diagnosis.
Huge focus. Biomarkers in spinal fluid, PET scans, even blood tests are coming. Diabetes, especially type 2, often preventable with weight, exercise, diet. Treatment is lifestyle plus meds or insulin, managing blood pressure, lipids, checking feet, eyes, kidneys, constantly.
It really feels like a pattern with these NCDs. Different diseases, but overlapping risks, diet, inactivity, tobacco. Tackling those behaviors could pay off massively.
Absolutely.
But doing that, it's not just telling people. It's tangled in poverty, access, culture, everything.
100%. And for many chronic conditions, the goal isn't really a cure like we think of it. It's long-term management, quality of life. That's key for realistic expectations.
Right. Which brings us to the biggest dream.
Ah, yes. Beyond managing, beyond controlling, the ultimate ambition. Eradication.
Wiping it off the face of the earth.
Permanently reducing a disease to zero worldwide. So you don't need any interventions anymore, different from elimination, which is just in one region. Eradication is the final victory lap.
And the shining example, the one everyone points to, is smallpox. How the hell did we do that?
Achieved in 1980. Monumental. Key was mass vaccination. They used smart tools like the bifurcated needle simple, needed hardly any training or vaccine dose. Very efficient.
And that ring vaccination thing.
Crucial. Surveillance and containment. Find outbreaks fast, vaccinate everyone around the cases, their contacts, build a wall of immunity, stop it spreading, plus massive community buy-in, international cooperation. It took everything.
So what did we learn? What made it work? And does that help or maybe hurt? Thinking about other diseases.
Smallpox was almost like the perfect storm for eradication. Heat-stable, single-dose, lifelong vaccine, no animal reservoir, only humans got it. Obvious symptoms that horrible rash, easy to spot cases.
Sounds ideal.
Almost. And even then, it was brutally hard. Taught us you need good tech that works in the field. Strategies have to be adaptable. Eradication is incredibly tough, even when things look good. You need unwavering political will, sustained funding, and failing.
Failing wastes tons of resources and goodwill.
Exactly. Can be worse than just sticking to control.
So proof of concept, but maybe a unique case. What are we trying to eradicate now?
The two big ones are polio and guinea worm disease. The Global Polio Eradication Initiative started way back in '88. Reduced cases over 99%, using vaccines, routine immunizations, surveillance, even checking sewage, and rapid outbreak response.
But polio is taking forever. What's the damn problem? Why is it so much harder than smallpox?
Oh, it's way more complex. A huge issue is asymptomatic spread. Most people infected don't get paralyzed, don't even feel sick, but they shed the virus.
Spreads silently. Nightmare to track.
Total nightmare. Then there's the rare but real issue of vaccine-derived poliovirus, VDPV. The live vaccine strain can sometimes circulate in places with low coverage and mutate back into a form that causes paralysis.
Wow, the vaccine itself can cause it.
Rarely, but yes, in specific circumstances. And wild polio. It's hanging on in really tough places. Afghanistan, Pakistan, conflict zones, makes getting vaccines to every kid incredibly dangerous, a logistical hell.
And the usual suspects.
Vaccine hesitancy, misinformation, brutal hurdles for getting coverage high enough.
What about guinea worm? Thought that was nearly gone.
Huge progress, over 99.9% reduction, targeting 2030. But a shocker recently found infections in animals, dogs specifically.
Oh man, that changes things.
Big time. Throws a wrench in it, suddenly not just a human problem anymore, makes eradication way more complicated.
Could we do measles? It's like a good candidate, effective vaccine, only humans.
Measles looks feasible on paper. Humans only host, good tests, great vaccine. The MMR regional elimination works. However,
There's always a however.
measles is insanely contagious, like one of the most infectious viruses out there. You need crazy high immunity, like 95% of the population to stop it.
95%. Globally.
Yeah, getting and keeping that level everywhere, giant pain in the ass, especially with vaccine hesitancy popping up even in rich countries, cities, travel, it just spreads.
And rubella.
Also technically feasible, mainly to stop congenital rubella syndrome, but infections can be mild, missed easily, surveillance is tricky, and there's a risk if vaccination isn't perfect. You could shield infections to older women, maybe even increase CRS cases. It's complicated.
So smallpox gave us hope, but it was almost uniquely suited. Polio and guinea worm show us biology, silent spread, animal hosts and society conflict. Lies make it incredibly hard. Measles shows even with a great vaccine, human behavior is a massive barrier. Sounds like total eradication for most diseases is just not happening.
Yeah. Based on everything we see, yeah. Wiping out all human illness. Not realistic anytime soon. NCDs are chronic, tied to aging, genetics. Pathogens evolve, hide in animals, exploit how we live. The biological hurdles alone are huge for most things.
Okay, so if wiping everything out is off the table, what about the shiny new tech? Where do things like gene editing, mRNA, AI fit in? Are these our new weapons?
They absolutely are transformative. Huge promise for the future.
Let's start with gene editing. CRISPR. Sounds like sci-fi.
It kind of is. CRISPR lets scientists make super precise changes to DNA. The dream. Curing genetic disorders by fixing the faulty gene. We just saw a massive moment in 2025, the first customized CRISPR therapy for a baby with a rare, deadly genetic disorder.
For one specific baby.
Tailored to his specific mutation. They infused gene editors, and early signs showed it working, reducing his risk. Sets a precedent for CRISPR on demand for rare diseases. FDA has already approved CRISPR for sickle cell. Research is hot for cancer, cholesterol, blindness.
But the hurdles must be massive.
Oh, absolutely. Long-term safety. Effectiveness. Huge questions. Off-target edits messing up DNA elsewhere, that's a worry. Ethics. Enormous. Especially editing changes that could be inherited. Current therapies avoid that, focus on non-reproductive cells, but still.
And cost. Accessibility.
Major problems.
Yeah.
Developing these personalized therapies is wildly expensive, and the regulations are still catching up.
Okay, mRNA. We all know the COVID vaccines. What's the bigger picture?
COVID showed the power and speed. mRNA vaccines basically give your cells instructions to make a piece of the virus, training your immune system. Super fast design, manufacture, really adaptable.
So beyond COVID.
Oh, yeah.
Yeah.
Developing mRNA vaccines for flu, maybe even a universal one, RSV,
Yeah.
and crucially for tough targets like HIV, TB, malaria, trying to get stronger immunity.
I heard about personalized cancer vaccines using mRNA.
Yes, incredibly exciting. Designed to teach your immune system to recognize and kill your specific tumor cells based on their mutations. Early results for melanoma, lung cancer look promising, often combined with other immunotherapies. Plus, maybe using it for rare genetic diseases, delivering mRNA to make missing proteins, and making the vaccines better, more potent, stable, maybe inhaled or swallowed.
And AI. Artificial intelligence is everywhere. How does it fight disease?
AI can chew through massive amounts of biological data way faster than humans, spot patterns, find new drug targets, screen compounds against diseases like malaria, drug-resistant TB.
So finding new drugs faster.
Potentially. Or finding new uses for old drugs repurposing, helping design better clinical trials. It's really promising for neglected diseases where traditional drug R&D is slow and expensive.
Downsides. Risks with AI in health.
Lots. Many AI models are black boxes. You get an answer, but not why. Algorithmic bias is a huge concern. If the training data isn't diverse, it could make health disparities worse.
You had tons of good data.
Exactly. High-quality, unbiased data, often missing for neglected diseases or in poorer places. Human experts are still essential to check AI's homework. Computing power, expertise barriers too, ethics around data privacy, security, fair access. Massive. And honestly, no entirely AI-designed new drug approved yet. Lots of promise, still early days.
So the tech offers mind-blowing possibilities. Personalized medicine, fixing genes, training immune systems, finding drugs.
The scientific promise is immense, absolutely. But actually using them widely, that means facing some major practical and ethical shit shows.
Right.
The terrifying cost of development and delivery, making sure they don't just help the rich, navigating complex regulations, building the data infrastructure, grappling with those deep ethical questions, especially gene editing, if these are going to actually help wipe out illness globally.
Getting them to everyone is as important as the science.
Just as damn important. And remember, these techs work together. AI finds targets for mRNA vaccines or CRISPR. mRNA delivery could be used for CRISPR. There's synergy.
Okay, beyond specific diseases and fancy tech, there are these huge, messy problems that just hang over everything, right? Systemic obstacles.
Exactly. These overarching challenges impact everything in global health.
What are the really big ones standing in our way?
Antimicrobial resistance, AMR. That's terrifying. The silent pandemic of superbugs that drugs don't kill anymore.
Undoing decades of progress.
Threatens to make routine surgery dangerous again, driven by overuse of drugs in people, animals, farming, poor infection control. Means more expensive, toxic treatments, more deaths. It's a huge slow-motion crisis.
That ties into society, doesn't it?
Absolutely. Socioeconomic disparities, lack of healthcare access, fundamental barriers.
Yeah.
Your income, education, job where you're born massively affects your health, and if you can get care.
Money, geography, enough doctors, understanding health info, stigma.
All of it stops people getting prevention, screening, vaccines, treatment. Diseases hit the vulnerable hardest. You can't make real global progress or eradicate stuff if you don't tackle these deep inequities.
And new threats are always popping up.
Emerging infectious diseases. COVID was the brutal reminder, driven by population growth, poverty, cities, global travel, land use changes, pushing us closer to animals.
So we need better preparation.
Definitely. Global efforts like the WHO Pandemic Accord try to improve preparedness, ensure fair access to tools in a crisis. The One Health idea, human, animal, environmental health, all connected, that's becoming critical.
What else is on the horizon? Big headaches.
Climate change. Expected to make things worse. More insect-borne diseases, more viruses jumping from animals. Declining public trust, rampant misinformation that cripples public health efforts.
Yeah, we see that all the time.
Aging populations, straining systems, data problems, AI risks, uncertainty in global health leadership. Big challenges looking towards, say, 2040.
So it's not just the bugs. It's drug resistance, poverty, access, climate, trust, misinformation. It's all connected.
Totally interconnected. Fix AMR, need better sanitation, linked to poverty, emerging diseases, tied to environment. Misinformation hurts any response. And the equity thing is unavoidable. If amazing tech doesn't reach the poor, its global impact is limited, and pockets of disease breed resistance and spread.
It's a constant battle against evolution and environment.
Our strategies have to be dynamic, adaptive.
Okay, so if we pull all this together, what kills us now? The progress, the eradication dream, the tech, these huge obstacles. What's the realistic outlook? Can we wipe out illness?
Based on the evidence, wiping out all human illness, no. Not feasible in the foreseeable future. NCDs are chronic, tied to aging. Pathogens evolve, hide in animals, exploit our behavior. The biological barriers alone are immense.
But what are realistic goals then? What can we aim for?
What we can and absolutely should aim for is significantly reducing premature death and suffering with the tools we already have. Big gains are still possible there.
Okay.
Regional elimination of specific diseases, we know that works, and highly selective, super well-resourced eradication campaigns for a tiny number of diseases with really favorable characteristics, knowing it's still ongoing vigilance even after success. Polio, guinea worm, those are the tough slogs right now.
And getting there, what's essential?
Sustained investment in R&D, new tools for NCDs, EIDs, AMR, global collaboration, stronger governance like that pandemic accord, building strong health systems everywhere, universal health coverage, primary care, prioritizing health equity, tackling social determinants, non-negotiable,
Fighting misinformation, building trust.
vital, and adaptive public health strategies. Ready for the next thing.
So victory isn't total eradication. It's this multi-layered, never-ending effort.
Exactly. Aggressive NCD prevention, robust infectious disease control, targeted elimination, selective eradication attempts, and constant, unwavering preparedness. The cutting-edge tech is thrilling, but it needs the foundation.
It needs clean water, basic vaccines, primary care.
Those fundamentals are still paramount, especially where disease hits hardest. The fight is continuous, demands commitment, solidarity, adaptation, and focusing on both innovation and the damn hard work of equitably using what we already know saves lives.
It really is a staggering picture, the sheer force of disease versus this incredible, often messy human pushback. We've made unbelievable progress, absolutely. But wiping out illness completely, maybe less a realistic finish line, more.
Yeah.
Just a perpetual state of battle, demands constant innovation, global cooperation, and a hard look at the societal issues that give illness its damn power.
Yeah, what's fascinating is how tangled up our health is, not just with science, but environment, economies, societies, even trust.
Think about the trade-offs, right? The huge cost of eradication versus managing chronic illness forever, or how basic sanitation can sometimes do more than the fanciest new drug. Given everything we've talked about, the threats, the tools, the future, the obstacles, what feels like the most critical place for us, for humanity, to focus energy and resources in this fight for health, something for you to chew on.